The impacts of these tariffs have yet to be felt. The impacts, however, are being felt disproportionately in the fourth largest economy in the world.
You just heard Governor Gavin Newsom calling out the ripple effects of President Trump's tariffs. Hello, I'm Laura Painter. Welcome to the ABC10 Plus Budget Breakdown. The governor is pointing to President Trump's policies for why the state has found itself in such a financial hole during his May revised budget presentations. In January, the state was projecting a small surplus, but Governor Newsom says the downturn in the stock market has led to a huge downturn in the state's projected revenue. Here's a look at some of the most notable numbers. The total budget is $322 billion. $226 billion of that comes from the general fund. The state is planning to maintain about $15 billion in total reserves. That leaves about a $12 billion deficit. That deficit means some programs and jobs are on the chopping block. ABC 10's Jeannie Nguyen was at the announcement. She has the details now on the governor's proposal and how lawmakers from both sides of the aisle are responding.
We were off. We were significantly off.
On Wednesday, Governor Gavin Newsom admitted the state was wrong when he initially predicted back in January the state would have a $363 million surplus in the state budget. Newsom is now blaming the Trump administration's actions for the lack of incoming revenue, calling it a, quote, Trump slump.
We're going to see an impact about a $16 billion downturn, not all in the next fiscal year, but fiscal year plus one.
Governor Newsom says the state is now facing an $11.9 billion deficit with a $321.9 billion budget and $15.7 billion in reserves. The governor's office wants to do several things, including using billions from the state's rainy day fund and even negotiating state workers' pay.
The intent is really to avoid increased costs in the upcoming fiscal year, and is not to implement furloughs or PLPs or those type of things.
The governor is also proposing changes to Medi-Cal.
$5 billion on a freeze on our Medi-Cal expansion. We're not cutting or rolling back those that are enrolled.
This would apply to those receiving Medi-Cal regardless of immigration status. The governor is proposing a $100 premium for undocumented immigrants, and the freeze would apply to new adult applicants older than 19.
We're just capping it, particularly for those without documentation.
In response, Republican lawmakers say the state cannot continue to provide Medi-Cal services to people without documentation.
We just simply can't afford it. And he's acknowledging that by this budget's adjustment. And in future budgets, I think we're going to see more.
Advocates for immigrants are fighting back against Governor Newsom's plan to freeze enrollment for state-funded health care for immigrants without legal status. But there are lawmakers who say the program was flawed from the start. ABC 10's Roxanne Elias explains the view from both sides.
Immigrant advocates are outraged at Governor Gavin Newsom's newly proposed restrictions on the state's Medicaid program for undocumented Californians.
I was completely devastated to see this news, to see the state choosing to balance our budget on the backs of working people, hardworking immigrant communities.
Under Newsom's plan, low-income adults without legal status will no longer be eligible to apply for Medi-Cal, taking effect next year. Josh Stalick, the policy director for the California Immigrant Policy Center, says it feels as if the governor is abandoning a proud legacy of bringing California to a state of almost universal health care.
It will end up resulting in folks being unable to access health care that they vitally need, which means that they'll be living sicker, potentially missing work.
He says it could also lead to systemic problems affecting all Californians in terms of potentially overburdening emergency room systems and potentially leaving hospitals uncompensated for the care. Amanda McAllister-Wallner with Health Access California is also worried for the people who already have coverage and are 19 years and older. The governor has proposed they pay a $100 monthly premium.
People making under $15,000 a year, under $20,000 a year, where paying $100 a month just isn't possible.
Republican Senator Brian Jones says he warned the governor over a year and a half ago that the program was not sustainable.
What's happening now is the governor for the last 6 years has been making all of these promises what he's going to do with Medi-Cal without really analyzing and paying attention to the outcomes.
In total, Newsom's office estimates the changes will save the state $5.4 billion. But Senator Jones says it's too little and too late to avoid the damage.
If you take a look at the cuts that we're going to need to make this year, that's legal residents and citizens that are paying their taxes that are now going to have some kind of service cut.
Roxanne Elias, ABC 10.
Roxanne, thank you. Immigrant advocates are now calling on lawmakers to oppose the cuts. They say they'll try to work with the governor's office to come to a final budget deal. Meanwhile, tens of thousands of low-income seniors and Californians with disabilities could lose Medi-Cal coverage due to a proposal in Governor Newsom's budget revision. ABC 10's Becca Habiger has what's at stake.
Elizabeth Gesamburu of Stanislaus County is talking with lawmakers this week.
I stopped into Joe Patterson's office, Don Addis's office.
She's advocating for herself and all Californians with disabilities who are on the Medi-Cal and in-home supportive services or IHSS programs, asking legislators to reject a provision in the state's budget proposal.
They don't want to see a step backward either, so that is encouraging.
She's talking about a cost-cutting proposal Governor Gavin Newsom unveiled last week in his May revision of the budget. It would reinstate something called the asset test.
It kept us in poverty. It kept us as second-class citizens.
For decades, a single person couldn't have more than $2,000 in assets. For a couple, the limit was $3,000. That limit did not include the value of a primary home, vehicle, or retirement fund, but did include things like a regular savings account, cash, and a second vehicle. Starting in 2024, the asset test was eliminated, and more than 100,000 newly eligible seniors and Californians with disabilities enrolled in Medi-Cal.
It was such a step forward for us to get rid of that asset test, and now to see it in the budget revision is heartbreaking. It's terrifying that we would be taking a step back in disability rights.
Governor Newsom argues the influx of enrollees cost the state more money than anticipated. His revised budget says reinstating the asset test for both Medi-Cal and IHSS eligibility would provide estimated general fund savings of $94 million this coming fiscal year, $540 million the next, and $791 million annually thereafter.
It's unjust and it's cruel.
Advocate Julia Feinberg lives in Oakland and says returning to that strict test is unrealistic.
If I get $1 over $2,000, I lose everything. And it is incredibly challenging to get that back. And in the meantime, I have to pay out of pocket for the caregivers that were taken away from me. So I'm going to go into debt because I wasn't allowed to save.
Mohammed Rashid of Modesto says the proposal threatens his health care too.
I'm feeling anxious and stressed out.
At an Assembly subcommittee hearing Monday, members questioned the director of the state's Department of Health Care Services.
Where are people going to go when they no longer qualify and can't afford this care on their own?
Individuals would lose access to Medi-Cal and would have to find other means to support the needs that they might have.
I think this is going to lead to more homelessness of seniors and the disabled, and that's what's going to happen, and that will cost our state money too.
In response, the governor's office tells ABC10, in part, under Governor Newsom's leadership, California became the first state to offer full-scope Medi-Cal to all low-income adults. But because of the $16 billion Trump slump and higher-than-expected health care utilization, the state must take difficult but necessary steps to ensure fiscal stability and preserve the long-term viability of Medi-Cal for all Californians. We will continue to work with the legislature to review budget alternatives that achieve a balanced budget for both this year and in the future.
That was Rebecca Habiger reporting. Turning now to education. The University of California system initially faced a nearly $400 million cut, but will now have about a $130 million cut. The California State University system had more than $200 million restored under the governor's new proposal. UC President Michael Drake released this statement on the budget proposal, saying in part, quote, "We are deeply grateful to Governor Newsom for recognizing the value of the University of California's contributions to our state in the May revise. This is a challenging budget year for California, and our state leaders are facing very tough choices. Even in this difficult moment, the governor has reduced the university's cut from 8% to 3%, demonstrating his strong commitment to California's students. The governor is also proposing a delay for the state's agreement with the university systems to provide additional funding if they meet certain admission metrics next year. Turning to environmental now, environmental groups are opposing Governor Newsom's funding for the controversial Delta Conveyance project, known as the Delta Tunnel. The governor is proposing changes to ensure the project is completed. ABC10's Jeannie Nguyen has the details on how these groups are pushing back.
With the Delta Conveyance project, which is in this budget, and one of the most important projects in the United States of America, and one of the most important climate adaptation projects in this country.
The Delta Conveyance project is one of the state's most controversial projects, and on Wednesday, Governor Gavin Newsom reiterated his support for it in his Budget May revise announcement.
We have got to move that project forward.
The state wants to build one 45-mile tunnel under the Delta to reroute water. It's estimated to cost $20.1 billion. In the governor's proposed budget, he recommends streamlining the process by making the permit process easier, allowing the Department of Water Resources to have authority over funding, and making it easier to get through delays caused by lawsuits.
And appropriately using the California budget process to push forward and make policy changes that will have detrimental impacts on Delta communities and the environment.
Restore the Delta is a Stockton-based organization that has opposed the project for years and has active lawsuits against the state. The organization says the governor is ignoring how this would impact wildlife, conservation, and native tribes.
It's also writing a blank check to the Department of Water Resources to fund the construction of the Delta Conveyance project, despite recent lawsuits.
On Thursday, lawmakers within the state's Delta caucus sent this letter to the Assembly and Senate, urging them to reject Newsom's proposal, saying it's, quote, costly and destructive.
I'm pretty angry. This is yet another attempt to railroad Stockton and the Central Valley.
Congressman Josh Harder, who represents portions of the San Joaquin Valley, agrees with state lawmakers, saying it will only waste the state's money, especially when we're currently facing a deficit.
This more than $20 billion boondoggle will not create a single gallon of new water for anybody.
And that was our Jeannie Nguyen reporting. The Department of Water Resources told ABC10 the governor's proposal would save billions of dollars by avoiding delays, and the project would be funded solely by local public water agencies, not the state's general fund. Meanwhile, advocates took to the state capitol May 15th to urge leaders to reject cuts to programs they say hurt working families, children, seniors, and people with disabilities. The group, which represents workers, immigrant communities, and foster youth, say the state should look to billionaires and big corporations to help close the deficit instead of cutting vital programs.
We have an opportunity to address this deficit by raising revenues that are fair, that are equitable, and that are common sense. And we don't have to do a balancing of this budget against the backs of the poor.
Well, keep in mind, the budget is currently just a proposal at this point. The legislature will have to pass a balanced budget by June 15th. One area the governor is proposing to save money is from state workers' paychecks. The revised budget includes major cuts to payroll. ABC10's Garth Sangha has a closer look at the growing concerns.
Governor Gavin Newsom wants to slash nearly $767 million in salaries and wages from the state workforce. One way to balance the budget.
The intent is really to avoid increased costs in the upcoming fiscal year, as not to implement furloughs or PLPs or those type of things.
In his May revised budget proposal, the governor says the state hopes to reach those savings through collective bargaining. He also warns if no deal is reached with unions, cuts will be imposed. And that is not sitting well with state workers like Danica Dupatti.
It's very disappointing. It's already hard just day to day, just even coming into work.
Longtime state employee Corey Pruitt remembers the last time something like this happened.
Well, unfortunately, this is deja vu for me. I was here when Arnold Schwarzenegger did the same thing.
SEIU Local 1000, which represents nearly 100,000 state workers, is calling it a step backwards. In a statement to ABC10, read in part, quote, "We are not here to help the state cut our pay. We'll fight to protect jobs, pay, and the services our communities rely on." The Union for California Correctional Officers say they're willing to work with the state, but only at the bargaining table, saying in a statement part, quote, "We remain committed to working closely with the administration to reach a responsible solutions." And the engineers' union PECG warns a deficit, whether real or projected, does not justify shortchanging essential professionals. A portion of their statement reads, "California has come through difficult budget times before, and PECG is confident we will again." Pruitt says state workers can't catch a break.
It's unfortunate because not only will they be making us make less money, but they're expecting us to come in even more.
Currently, negotiations are underway with 7 unions who have their contracts expiring this summer. Now, that proposed budget did say all negotiated health care coverage is expected to remain intact. Reporting from the state capitol, Garjpal Sangha, ABC 10.
Garjpal, thank you. We still have a long way to go before any of these proposals are finalized, as the governor will need to negotiate with the legislature to create a final budget that must be approved by June 15th. Stay with ABC 10 as we bring you the latest on those negotiations throughout the process. Thanks so much for joining us. I'm Laura Painter. See you next time.